Ted, will you lead the pledge, and Ben, will you do the opening prayer, please?
Yes.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Just bow your heads. Lord Jesus, we thank you so much for all that you give us. We thank you for this time of celebration. We celebrate your birth, and we thank you for this time where we can come to this meeting. We ask that you give us wisdom and guidance and direction, and help all we do to be for your glory. In name I pray, for Jesus Christ.
Amen. Amen.
And do you want to mention to her that you want to add to the agenda? Or?
I did.
Okay.
Yeah. Any visitor comments? Looks like it. Okay. Next on the agenda is the approval of the minutes of the November 20th meeting and the December 8th special meeting. Has everyone looked at the minutes?
Mm-hmm.
Is there a motion to approve the November 20th, 25 minutes?
So, second.
It's been moved and seconded. Is there any discussion? It's been moved and seconded to approve the November 20th minutes. All in favor say aye.
Aye.
Aye. Same sign, opposed? Opposed, same sign.
Can you hear Ann?
It is amazing how well I can hear. It's the best I've ever heard on Zoom.
Okay, good deal.
Is there a motion to approve the December 8th special meeting?
I make a motion to approve.
Second.
Any discussion? It's been moved and seconded to approve the December 8th special meeting. All in favor say aye.
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 All opposed, same sign. Motion carries. The minutes are approved.
Well, that's quick. We've never done that.
Additions or changes to the agenda?
Madam President, I would just like to add communication discussion. These are just some ideas that I would like to brainstorm.
Okay. Where would you like to add those?
It doesn't matter to me.
How about after the strategic initiatives? It would be after foundation.
Yep, that works for me.
Have a motion to add to the agenda the communication framework.
Madam Chairman, I move that we approve the agenda with the addition of the communication framework.
As item I.
Yes.
Second.
Any discussion?
I was going to call it
Okay.
I know, that's why.
So it's been moved and seconded to change the agenda and to approve the agenda with the amendment of the addition of the communication framework to item I. All in favor say aye.
Aye.
All opposed, same sign. Motion carries. The agenda has been approved.
Seconded, but you made the motion.
William. Next is Polly, you're up.
Hello, everyone. I'll go ahead and give you a quick rundown on the happenings. So for Weston County Health Services Board report for 12/18 for infection prevention. As of December 18, 2025, the facility's influenza vaccination rate is 74%. This represents a decrease from last year's total of 79%. The COVID vaccination rate remains low at 4.2% this year, which is consistent with rates observed during the previous year. Influenza and COVID numbers remain seasonably low at the moment, with a considerable spike or cluster in strep A infections coming out of the clinic for the month of December. No outbreaks reported in acute care or long-term care at this time. For safety, workers' compensation claims remain stable with a total of 12 claims reported year to date, compared to a total of 8 claims in the calendar year 2024. For quality, Group C Quality Committee met the following are departmental reports in progress of performance improvement projects. HIM reports there's no open charts as of 12/10/25. PT updated their project on enhancing communication between physical therapy, home health, and acute care by having weekly therapy huddles to discuss patient therapy needs, plans of care, schedules, in-room exercises, and physical abilities and limitations. The clinic updated the group regarding several projects to include adoption of streamlined services, increased patient flow, and minimize sharing of information, privacy and atmosphere, and quality of visits. The quality data transfers out of facility for November are 13, with 3 going by flight, 6 going by ground EMS, 3 private vehicle, and 1 sheriff's office transfer. Manor transfers for the month of November were 6, 2 resulting in interfacility admissions and 1 out-of-facility admission. For the ED readmits within 72 hours, there was a total of 5 patients seen twice, with 1 patient being admitted interfacility. And we will cancel the upcoming med staff meeting if any of you attend, dated December 23rd, and we'll pick back up in January, and I'll send those emails out here pretty soon. Any questions?
Thanks, Polly.
Perfect.
Thank you.
Do you have anything to add, Ben?
No, I do not.
Quality.
Thank you for asking. No.
Okay, next up is the man report. Jim.
So I gave you guys a handout. It looks like this. I forgot to put the map on here, so this is my handout. Current census is 53 residents, so our occupancy rate is at 91%. Payer mix, we've got 32 Medicaid, 5 Medicaid pending, 15 private pay, and 2 VA. Admissions and discharges in November, we had 1 admission and 1 discharge due to death. Staffing overview, the agency utilization, we're still high on our CNAs. We've got 10 currently in the facility and then 1 RN as well. So just kind of a summary, we have a high occupancy rate of 91%. The payer mix continues to be predominantly Medicaid with moderate private pay presence. Admissions and discharges were balanced in November, indicating steady census trends. Agency staffing is currently supporting operations primarily with CNA coverage with limited RN agency use. We do have some additional plans in place to work those agency numbers down and get them out of the facility. With the Medicaid pending, we are working on a process that while they are Medicaid pending, they turn their Social Security into us as the payee minus the $50 that they get to keep monthly to help with some sort of payment towards their monthly bill. And then kind of like I said, the staff utilization, we've got 10 CNAs, 1 RN. They present a high labor cost for us in the manor. So working on that to make the margins better. So we're continuing our strategies on the Medicaid, making sure that we've got everybody Medicaid pending applied for all of their paperwork into Medicaid. Medicaid is taking about 6 months though to get people approved. And so that's presenting a problem for us as well. And then we're going to prioritize a recruitment and retention of core staff members to get rid of the agency costs. We did recently have surveyors in the building. They were here last week. We had 5 surveyors in the building. We had 4 state surveyors and 1 federal surveyor. So with them coming in, that federal surveyor, we are good for 7 years now. So kind of here is what they were here for. So they were here for certification with 3 complaints. 2 of those complaints were substantiated. One of them was an abuse, resident to resident, and because the incident did actually happen, we had a couple of roommates who had a disagreement get into a physical altercation. Because it did actually happen, they tagged us with an abuse. However, because it is resident to resident, it doesn't affect our nursing home compare. So if you guys are familiar, if you have an abuse tag, if it's staff to resident, you get a red hand that just alerts family members that it could be a risky place to put your family members. So we don't get that on our website. And then call lights, they did substantiate that as well. A call light was found on the floor. So call lights must be accessible to residents at all times and within reach. And because it was on the floor when they came, they did substantiate that complaint. We got a tag on admissions and discharge. We didn't have any written evidence of our transfer discharge notices. So basically our bed hold, what we do is we call family members and let them know that their loved one was transferred to the hospital, but we weren't providing them that written notification saying that, yes, we want you to hold that bed. So we've got a new process in place where the family member will either have to come in and sign it, or we'll have to send it certified mail so that we can prove that we did our due diligence with sending that report out. Resident assessments, we had a resident discharge home, and then after a month she came back and she had a new diagnosis of post-traumatic stress disorder. And because that was a new diagnosis, we should have done what's called a PASSR level 2. And because we didn't do that, we don't have that on file, we got a tag for that. And then quality of care, wound management, we were supposed weekly wound assessments lacked required measurements. So we were doing the wound care, we just weren't appropriately documenting the size of the wound. Nursing services, call light response times were not consistently documented. And then medication documentation issues. We got a citation for targeted symptoms not documented, which means we had a resident who was being treated for anxiety, and that's all that we were watching for was anxiety, and they wanted us to break it down more. What does anxiety mean to that resident? Does that mean that she gets short of breath, she gets weepy, she gets depressed, does she get weak in the knees, those kind of things, breaking down those symptoms to be a little bit more specific. And then that same resident had a medication dose increased by the geri-psych provider based off of information that she told the provider, but we didn't have any documentation to support what the resident was claiming. So we needed to either verbalize that to the geri-psych provider that we weren't seeing these behaviors, so that that medication increase wouldn't have happened. And then the next one was the dietary food services. One employee was caught not wearing a beard net. So if you have a beard and you're in dietary, you still have to wear a beard net as well. Sanitation bucket temperatures were inconsistent. They weren't documented every day, and the sanitation bucket is only good for so long. It needs to be a certain temperature to make sure that the germs are all killed. And then the walk-in cooler and freezer temps were only taken sporadically. They weren't taken daily. So we do have a process in place now to fix that as well. And then infection control, when they were observing, one of the catheter drainage bags was found touching the floor. So when they lowered the resident's bed, the catheter bag, I believe, was hanging on the side of the bed. And when they lowered the bed, that bag then touched the floor, which poses an infection control problem. And then the other infection control was a pneumococcal vaccine was due for a resident. And she didn't have an administration on file, nor did she have a declination. And if she doesn't ever want the pneumococcal vaccine, she has to have an annual declination while she's in our facility. So just some minor documentation pieces. So I feel like we did very well, especially for having a federal regulator in the building as well. So, any questions at all? And this is all just preliminary. We haven't gotten the actual report from the state. They have 10 business days to get that to us. And then we have 10 working days to return our plan of correction to them.
But your sense is it was a fair assessment?
I believe, yeah. Yeah.
Thanks.
I don't like it that they deem you for a resident on resident if you didn't, I mean, but that's the law. So at least it's not going to affect our scoring. But I've never heard of that. I've actually never heard of getting a tag because 2 residents got into a tussle.
Yeah. That's all I've got. If you guys don't have any questions.
Thank you.
Okay, next is planning report.
I just want to make it clear that my name is spelled Trisa. There's no H. You'll all get used to that eventually, but that's all right.
For the month of November, our patient volumes and operations, we were a little bit slow. I'm in November, but I want to attribute that to the beautiful weather that we were having, unseasonable favorable conditions, and so. We're right off to a great start already for the month of December. As of today, we're at 428 patients through today. So even if we see another 100, we're gonna be very close to our November. Our culture and engagement, November was a culturally positive month. We had a turkey board with feathers that people were able to write what they were grateful for in our waiting room, and that was very successful. We had a lot of really nice sayings that were on there from our patients. For the month of December, we have holiday movies playing in our waiting room, which show kids that are coming in with, as Polly says, strep, has been really nice. And so that has kind of taken off a little bit of the anxiety of going in the back. And we've been giving away packages of cookies and candy canes. For that, we've been decorating, and it's been really received well. Our process and improvements for our revenue and integrity. We have several key process improvements that we've been working on. Outpatient registration and billing. We had a really good month for registration and collection of copays. We've been tracking that on our QAPI project, which if you want to see that, I know that Mary and Ben was at the meeting, but you can kind of see how we're tracking those things. We're making sure that any manual corrections in the system is functioning as designed, and then we're opening tickets as we're finding situations that are not running as according to what Epic should be. Our QAPI focuses are pretty extensive. We've actually installed a new camera at the check-in desk so that each patient that is presented is actually, they don't have their photo ID. We're actually taking a picture and installing that into their Epic My chart so we can have proper identification. We're actually running all of our insurance, and most of the check-in is actually being queried, and you can see the results in the QAPI project as well. We have been receiving over 90% for our collection rates, just so that you know. Beginning January, all new insurance cards will be scanned. Patients will be required to have a photo ID associated with their chart. Staff has been encouraged to ask for email addresses. We have My Chart instructions that are out front of the check-in desk as well, so that we're encouraging people to access that, to be able to see their lab results, to be able to get access to their information quite quickly. Our community outreach, yesterday was our first senior center visitation. We had about 50 senior citizens yesterday for lunch. Dr. McCarty gave a speech on diabetes education. Heather was there from home health, and Tammy was there for the emergency management system that we've been putting in community-wide. And so that was really received well. We do have another date for the senior center already for January 14th. They are very excited to have us back. And I think at that one, we'll probably send Kelly Randerman over. Our staff recognition, Dr. Akers left us this last week. And on the 10th, we had a surprise going away party for him. We brought in food, and we had his wife come in early, and he was very surprised to see her. We gave him a stethoscope on participation from donations of the clinic staff as a going away present, because he did break his on his very first day and didn't replace it. So it was very nice to have that as a going away. Our facility safety, our beautification project is now 100% complete. If you have not been by the clinic in the daytime, I encourage you to. We've had a lot of really great response of the cleanup. A lot of people were out walking, not yesterday, but maybe the day before, and just saying how nice it looks. And I just really want to appreciate that. I appreciate you giving the money to do that. I know it was a lot, but it's been very well received by everybody that's been coming in. As you can see on the numbers that is attached, like I said, November was 546, but we're going to just continue to trend upward. We've had a ton of walk-ins right now because of the sickness that is going around. We are seeing quite a bit of strep. We have not seen a lot of flu yet, but strep is definitely circulating. So, questions, comments?
I just had a couple. We did drive by yesterday and saw them cleaning up in front of the clinic, and it does look really nice.
Thank you.
And the other thing, the community outreach, which is part of what I wanted to add to the agenda. I am thrilled to see that happening. You know, that I think the more visible presence we have within the community, it's gonna be a positive thing.
Charlotte, for this next kicking off for January, we're doing live doc talk on our Facebook Live. So we will be having all the docs do doc talk. And so we haven't decided what we're going to name it yet, but they're going to be choosing the topic and be doing that. So I think it's going to be really good for people to engage, ask questions. We have also thought about going on Friday mornings, just kind of a howdy and shake, just because it's caramel rolls and coffee. And so no better way to associate our doctors with those patients that maybe want to have a one-off conversation than eating cinnamon rolls and drinking coffee. So get those diabetes rates right up. I know. I think so. Yeah, it was really well received. There was a little bit of community, maybe some frustration that they didn't know certain people weren't here, but at the same time, we're putting it in the newspaper, we're advertising, and unless we go door to door, I don't know what else to do, but we're going to continue to hang flyers this next time. We're going to put them at Deckers. We're going to get out advertisement out quicker. So maybe we can get more than 50 people this next time. So we're going to be excited.
Well, and I'm probably jumping the gun a little bit, but on my handout, one thing when I was visiting with Jen Womack yesterday, she said those trifold, she calls them tints. If you let her know ahead of time what's coming down the pike, she said advertising is free.
I'll get a hold of Jen and I'll get it on the schedule for the 14th because that's
that'd
nice.
be.
Because they sit on all the tables around in the restaurants, so that'll be great. I didn't know who to call, so thank you.
Yeah, it's Sagebrush Market.
Okay, yep, I know that. Yep, because I saw all your wreaths in there for the holidays, and so I'll make sure I get a hold of Jen.
Okay, perfect.
Yeah.
Well, like I said, when I told her I was putting this on the agenda, that she said, please let them know that advertising is free, and they're working on January right now.
Okay,
So
I'll get a hold of her tomorrow. Thank you so much for that.
Any thoughts about going to Upton to the senior center?
I hadn't talked about that, but can you give me some information on who to contact?
I will.
Okay, if you'll give me some information and I will get with them as well, because I did not know that there was, forgive me, I did not know that there was a senior center out there.
Yeah, no, there is, and
Okay.
It wouldn't be 50
No.
people,
Well,
but
it would be really nice to be able to do that on one of the days that we're there and be able to
That would be
associate that, because
okay.
Dr. McCarty is having a normal day out there as well. So it would be really good to have him on that schedule.
I'll get you your name.
And
Thank you.
the time that Travis told me with them, because I've been over there to talk to them
Okay.
before, and they're best to catch at lunchtime.
Okay.
That's their
Well, and
better
that's a
time.
really good time because we do have a little bit of a break during that lunch hour. We can schedule that around
I
there.
think that would be a
Awesome.
good time.
Yeah.
Mm.
We can definitely
And
do
I think
that.
lunch is starts at 11:30.
Okay. We'll definitely get on that schedule, Mary. Just if not, I'll holler at you.
Okay, thank you.
Thank you.
Anybody else have any questions? All right. How about Rebecca?
Well, let me apologize for not having a report to you. That's not the norm. It has been busy. That's not an excuse. It's just reality. So, that said, I do have some things that are happening, obviously. So the I-9 audit is on track. So next meeting, I should have a little clearer picture, but I would estimate it 75% complete. So we do have some major deficiencies, but nothing that I'm not used to addressing. So we have 23 open positions, and it seems very high. It's because we've talked about the need that we need to transition our travelers out. So 14 of those are CNAs, and that's multiple departments, mainly the manor. So we're going to be boosting recruitment, working with Charlotte about social media and getting advertising. I've been using LinkedIn to boost our recruitment. I've also been on LinkedIn writing articles to boost the page for the hospital. Paul and I have been collaborating on moving to do software, doing some research on that. So hopefully in 2026, we will have an idea of what we would like to transition to. It may be ADP. We're not sure yet. So open enrollment ends on the 20th. It's a pretty passive enrollment because everybody is primarily keeping their benefits, so they don't have to do it at this time to make changes. And in January, I didn't get to finish it. I was working on it. I'm working on some new turnover reports to you. So when I'm coming to meetings every month, I'll be presenting you more statistical data. And my goal is to ultimately go back a couple of years so we can get more of a trend. That is it.
Thank you.
Thank you. Next is Denalda.
Okay. So our current census today is 4 skilled swing beds, 1 intermediate swing bed, and 1 acute care. We've got 2 skilled swing bed patients scheduled to be admitted tomorrow, and 1 of the skilled swing beds will discharge home tomorrow. November was a bit slower than October. There was some low census days for the staff where people went home on call. Just kind of 1 day out of each week, I would say. We had a total of 19 admissions in November. 14 were acute care, 4 were skilled swing bed, and 1 intermediate swing bed. The staff saw 162 emergency room patients. 4 of those were admitted observation, which is an extended ER where they're on the acute care floor just overnight or maybe for 2 nights for overnight monitoring. 2 cardiac rehab patients in the month of November for a total of 3 sessions. Our travel staff in November, there was 1 RN and 1 CNA who both completed their contracts. I've been interviewing CNAs to fill 1 full-time night shift and 1 full-time day shift position. But I've had to bring in travelers to cover those beginning in mid-January until we can get somebody hired for those. My nursing staff has been doing some OB education provided by Campbell County Memorial Hospital, just because, you know, they want to be more comfortable if we were to have an emergency delivery. So staff from Campbell County have been coming over to teach the classes, and the response from my staff has been very positive. The class itself is funded by the Emergency Medical Services for Children group that is that has for us, I don't know what I wrote there. Anyway, it's this money to fund our pediatric needs. Coming up in January, there'll be nurses taking the Pediatric Advanced Life Support class taught by Tammy Dowding. She is our educator, and we're lucky to have her to do all these classes so we don't have to travel. And in this class, we stay certified every 4 years. The Vapotherm purchase is still pending, the money from the foundation. And lastly, the QI projects I'm currently tracking include discharge vital signs for the ED and inpatient, and then oxygen saturations on and off oxygen with and without activity for all admitted patients, especially if they have new oxygen needs. And that just makes our transition to Lynn Care for their oxygen at home just easier. That is all.
Question?
Thank you.
Thanks.
Thank you.
Next up, finances. Paul.
Right. Everybody have their nifty little packets here. Start here at the financial performance page. Someone has that. So just walking right through it. So November was our slowest month out of the past 5 months of this first half of FY25 going into 26, FY26. Our biggest tank was the clinic visits at negative 266 patients. If you look at it month over month. However, October, it's important to remember that October was one of our best months throughout this FY. So when we're looking at the month over month negative, it's important to realize that you have to look at the historical average as well. And so that'll get us to roughly negative 6.9% patients. So it's much more modest if you look at it in context. I won't go through all the line items here on the volume piece, but essentially it was a slow month. That's kind of the bottom line.
And it's historically that way on them.
Yeah, that's exactly right. It's historically kind of very slow in November. It's the most traveled month out of the year for the holiday, for Thanksgiving. And so because of that, we didn't see a lot of kind of patients in the hospital. So if we want to turn the page here, you'll see financial highlights. Just turn it one more time. That'll give us our pro forma. So I know part of the reason why y'all brought me in was maybe a little bit on the education piece.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
So the pro forma really looks at an abbreviated line item version of the income statement. And so what it is it's all the major line items in the income statement. And it's supposed to show the consolidated view of the period in which we're looking at. So if we're starting at total patient revenue in the middle of the page there for the month ending November, we had a top line revenue of 1.735 million. We had deductions in the form of contractual adjustments and all that for 29,854. We had a little bit of a refund here on the other operating revenue side of $24, but it brings us down to the net patient revenue of 1.705 million. And then what you want to do is subtract out all of your operating expenses related to that operation of the hospital. So that's going to get you down to 836,162 negative. So we lost 836K this month on the hospital operations. Moving straight down on that is our other comprehensive income. So this is income that's not necessarily related to the running of the hospital for the services themselves, but kind of incorporates in our daily operations, just not related to direct operations. So for this month, as compared to last month, you'll see last month was $224,381 for our non-operating income. This month was only $103,450. We add back our interest income for $8,382. And then we take out our other non-operating expenses there for $7,709. So it almost nets out. So that gives us a total net loss of $732,039. And honestly, it's, context really is important in these situations. October, again, was one of the best months we've had in this FY26. And so when we think about it, the income statement really shows you across a period of time relative to your operations, but it doesn't really show you exactly how the hospital made money across the period. You still need the other two statements. So when we think about this, the 732 looks like a lot, but there's some really positive things that happened in the month of November. So real quick, I'll just touch on the bottom piece here where it says context matters. We lost roughly 20K in grant revenue. We lost, for non-operating income, we only had 103K, which really represents a decrease of 120.9K in non-operating income. So again, that piece of income that's not necessarily related to the hospital services operations, we lost about 120K of that. And then of course we had a little bit of interest there at 1.2K, just a touch, but overall it was an operationally difficult month, just given volume. This is all based on volume issues that we're seeing in the hospital this month. Turn the page here. So when we think about the financials and we think about performance and how we really measure and gauge performance, the two statements that I really enjoy are the balance sheet and the cash flow statement. The balance sheet's going to tell you where you're sitting during a period of time. It's like a snapshot in time. And then the same thing with the cash flow statement. The cash flow statement's really important because it wrecks all cash movements on the balance sheet. So if you see any differences up top there on the balance sheet relative to the cash flow statement, those differences are going to be calculated on the cash flow statement. So when we think about it, we start with our net income, $732,000 negative. But then if you look where I have the cheeky, this is what truly matters, bolded there, that the net increase or decrease in cash. And so we actually were able to turn out $310K worth of cash that was locked into the balance sheet in the form of accounts receivable. So how did we do that, right? So that was through our RCM process that we've had with Inova. That's our third-party RCM provider. They've been doing a really great job this month and last month in November to make sure we're turning out that locked-in accounts receivable and turning it from sales into cash. So on the top right, you'll see some highlights here. We had a net increase of cash of $310.2K. We had a reduction in accounts receivable. So that, again, that's turning sales into cash for $965K. We decreased our current liabilities for $226K. And then we reduced our long-term liabilities by $10K. And real quick on that note of the $10K, that's a reduction in interest and interest expense. So what are our key takeaways here? Reducing AR turn sales into cash, like I said. Reducing the current liabilities really unburdens our free cash flow in future periods, because if not, we're going to have to take the cash flow that we earn now or did not earn now and then pay that down later on. So what it does is it frees it up in future periods. And then when we think about the long-term liabilities, we're showing our creditors that we're able to meet our long-term debt obligations, showing that we're actually financially healthy, even though we had a bad month. All businesses technically, they have a bad month. So when we look at the cash flow statement, again, it just directs the cash movement to the balance sheet. Our operating activities, so that's what generates income or loss for the actual operating portion of the business, in our case, the hospital. And from there, we had a positive cash flow, and it was really driven by that $965K in reduction in accounts receivable. So with that, if you follow that all the way through, straight down the line, you'll see the operating activities at $627K. So there were some losses in there related to kind of everything on the liabilities portion of the balance sheet. And so that's a net of what the cash movement was for the operating activities. So we started out with the 965, it came down to 627 positive. When we're looking at investing activities, we bought that MRI machine, right? So that was, sorry, thank you. I knew I was going to get it wrong. So we bought the CT machine, and we bought a few other ancillary pieces of equipment with that money that came from the outside. That total around $424K. So that's a positive for us, because that allows us, we're reinvesting in our business. We're then allowed to give more products and services to our patients, right? So it's really good in the long term. And then, of course, in financing activities, you're going to see that $9,394, and that's paying down interest and long-term debt. And so, again, we're freeing up our future cash flow. So, yeah, November was definitely a slow month, but we're doing good with respect to the sales to cash collection engine. And that's a credit to this team here, as well as Inova doing their part to get the RCM collected. And yeah, we're reducing that future free cash flow burden by paying off our long-term obligations. So it's very healthy. It's a very healthy picture. Any questions on this before I move on? Because this is a neat as a finance right here, these two statements. Nothing. So I included this quick snapshot of the aged accounts receivable, and this is kind of what the Inova team and the rest of the team here are working on a daily basis. And this shows our outstanding, essentially, cash that the goods and services have been provided for, but we have yet to be paid for. And so I'll draw your attention to the top line, Medicare. And I know that these snapshots look vastly different than the ones you all saw from October. And so we're trending in the right direction. The whole idea is to reduce all of these balances down to zero. We know, whether or not that's probable, that's another story. However, we're moving in the right direction. Medicare continues to be one of the largest pieces on the hospital side with respect to collections. Self-pay and government are kind of the top 2 and 3, if you want to lump the self-pay, uninsured, and residual together. The government as well on that note are also a very big balance. We're working diligently to get those paid to us. It takes some time. We kind of hit the hammer every single day trying to get this money collected. I'll draw your attention to clinic side, that's the lower graph right there that shows the aged AR. Really, it looks a little different. We only have 121 days plus outstanding. That's kind of the cutoff there. So that's what's driving that. But again, self-pay is, of course, our biggest driver with respect to the buckets. And so we're really thinking of ways internally on how to reduce the possibility of having self-pay hit this aged AR. And some of the things we kind of discussed last night at our finance committee meeting are the ability to maybe offer some level of self-pay option from a different charge master sheet that makes more sense for the self-pay people that come in and want to pay for services themselves, right? Another piece of that is offering credit through Care Credit or Innovate, depending on their situation, making sure it's right for them. But having that ability to essentially offload the liability if we don't get paid to either a creditor or getting the cash up front is always going to be good for our balance sheet and will allow us to continue to operate and provide services to the community. Then real quick on the next sheet.
Just a quick question, Paul.
Sure.
Does Inova, are they taking care of the clinic part too?
Mm-hmm.
Okay.
Yeah, we had to go through a whole lot of credentialing work and other things. We're still cleaning up a few things, but these numbers, if you remember them from last time, the days out, we used to have like in the 181 days or the 121 days, a whole lot more money sitting in there. So that's a good sign that we're getting rid of some of that old stuff, which is what we asked them to work on at first to get it done. And I have seen a marked change there.
Yeah.
And we only wrote off so far. We're going to be doing more, but $18,000. So.
And so what will be helpful probably for next meeting is that I'll do a crosswalk between what we're seeing kind of now and then the next period and call out what was paid, any reductions for write-offs. And so you can kind of rec across the timeline to see exactly what we were getting out of our relationship with Inova. And it will provide that comprehensive picture of our relationship and how well it's working. So right.
Just if I can interrupt just a minute, I think that's like, to me, seeing that, I really like this, Paul. Thank you very much. But that piece of the people not like at the clinic, to me, there's no reason to have any self-pay that's not paid. Like every time I walk in there, you have to pay when you walk out.
Well, I think, and there's a couple of things there. When we didn't have people collecting co-pays or any kind of pay at not that long ago. And we've changed that with the help of Trista's leadership. The other thing is that we didn't put into place like we were supposed to that sliding scale fee piece for people that, depending on their income, what they should be able to pay. So I think those pieces, if we remember that a lot of what you're looking at for them has to do with credentialing hiccups and with, so then getting to self-pay even has been hard, but it's still showed up on our AR, right? But I think that you're going to see that that's a lot better. In fact, I can remember when we were, 5%, if that, getting our collections. Now we're doing that at over 90%. So I think you'll see an improvement.
That's great. Yeah. That's good. So,
and with our nonprofit status, we have to be kind of careful. We can't just,
right. Yeah.
Pay or go. So, yeah.
I'll have a question.
Yes, sir.
So 18K written off in November. That's what you said?
Let the number 18K.
Yeah.
Yes.
Is just, I have no idea. What would you consider a industry or a proper level for that to be at? What would you monitor? I mean, I know we shoot for 0, but.
Yeah, so it really depends. It depends on the size of the hospital we're talking about. Like, for example, University of Pennsylvania has very little as compared on a percentage basis to their AR. For the situation that we're in, I feel like 18K is pretty nice, and that was due to aged out receivables. So after, I think it was a year.
Yeah, it was over a year. It was one that didn't get collected because we didn't bill it timely.
Okay.
So, and we're going to see probably some more of that before we're done, but yeah.
All right. Thank you. Appreciate it.
But hopefully we're on the upward trend.
Yes.
with the Nova doing the aging accounts and stuff, that,
Yeah,
And we just collected 965K in a month. Yeah, we're
yeah.
on the upward track.
Yes.
I have a question. Has there been any complaints from the public about if they had to get a hold of Inova? Have they had difficulty doing that, or they're?
I have heard from, I've heard a little bit of complaints, and I think it is more from our staff trying to solve things between them and Nova, so that's something we still need to work on. So it's more about we're dealing with it, but we don't get an answer back right away. On the flip side, sometimes people get an answer right within a few minutes, so I do think there's work to do there still, but overall, that's what I've heard.
Okay, thank you.
Yeah. In fact, actually, I had a patient send me a letter that said, "Thank you, Kathy, because for the first time in my time going to the hospital, I actually got my bill paid that they've been trying to fight for over a year and a half. The bill is paid and it's all settled and cleaned up," and said that they've never had that happen with this hospital before. So, yeah, so it's one person it counts, because that person was very angry about that situation. So
Yeah, and there's actually more stories like that, right? Like I handled 3 stories myself. One with older lady had a bill of, I think it was $637 from 3 years ago, that it was the wrong bill. It wasn't billed properly.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
We were able to handle that in one day. Another gentleman had his poor wife, she passed away. He had to pay up front for her to stay at the manor, or I'm sorry, at the swing bed before she passed. And we were able to get that refund out to him in a matter of days before Thanksgiving, and he was very thankful and appreciative. I personally called both of them to make them aware that I was on the case and I was going to get it done very quickly. I was able to deliver on those promises, so they were very happy about that. That's the part of the job that I love, actually. So that's makes me feel good.
Awesome.
So this last kind of slide here, and in your packets, you'll have more pieces of information. They really go into volume graphs, some selected commentary around departments. But for this purpose here, I figured we'd keep it with the highlights. This month was actually very good for us. We were able to secure $1 million low interest revolver, which is going to help us normalize cash flows as we have to go out and pay for gap payments to receive Medicare kind of refund gaps. And so, for example, we have a $702,000 Medicare gap payment that's due on the 22nd, right? And typically what would have happened was we would have to dig into our pockets, to our cash flows, to pay that $702,000 and then wait however many weeks or months before we got reimbursed for $1.4 million. And so what it does now is it looks at the situation and says, okay, we'll take the $702,000 out of the revolver, not touch our cash or operating cash, and pay for that gap payment. So it's kind of a 1-for-1 from when we get the return back, and it makes our cash flows normalized across the period of time so that we're not cash strapped for an elongated period, maybe a quarter, for example.
And then get behind on our bills.
Exactly. So that's what I try to prevent there. That goes into kind of bullet 1 and 2. That gap payment, we actually found out that we didn't have to pay a $43,000 gap payment. They calculated it wrong. I gave the young lady a call up at state and I said, hey, I just want to make sure that we have this gap payment to pay. And on the phone, she was like, yeah, it's actually the wrong amount. We owe you $43,000. So I said, great. Yeah, let's get that check in the mail. Perfect. Thank you. We're fixing the broken accounting process, as most of you are aware. And I have a quick list, a rundown of all the things that we've already done. So everything in the bank accounts are reconciled except operating cash. That's one of our biggest accounts. We're working through that right now. We cleaned up 3 out of the 4 prepaid expense accounts and wrecked as of June through November of 25. We wrecked the equipment loan that was outstanding. It was like a negative balance on the balance sheet. It just didn't look right. We started working on our AR accounts. That's going to take a little bit of time, as you can tell, with all the stuff outstanding. So we have to go through each one of those piecemeal and make sure it's recognized in the AR and that there's no gaps. We're working on the I can't read my own handwriting. I'm sorry.
That's
sorry. Working on all balance sheet accounts, right? So we actually have 402 balance sheet accounts on our chart of accounts. So, right, which is a lot. It's not unheard of for a hospital, but it is a lot. Order of magnitude wise, probably 50 or 60 heavy, so that's something when you're, one of 2 people working through it and still pulling the CFO job during the day. So we're working through that as well. It's taking a little bit of time because in each one of those accounts, there's obviously a charge that you have to tie back to and make the notes and make sure the journal entries are going the right way. It's a methodical process, but boys along. So we're working through that as well. And last but not least, we reconciled the miscellaneous clearing accounts that were kind of hanging out there as suspense accounts for payments that they thought were due or maybe weren't due, and there was an error. So there was an account there that was just kind of unaccounted for, if that makes sense. And we had to make sure that there was nothing hanging out there that threw a flag. So working through that. We're also working to get an agreement signed with one of the 3 names listed below, either Pershing, Oakley and Associates, BDO, or CLA for our forensic audit. We're nearing the completion of the kind of introductory period with PYA. BDO has already have looked at Weston County before, and so they're already up to speed on maybe what needs to happen. We're re-engaging with them as we speak. And finally, CLA just reached out on Tuesday of this week, and so I'm setting up a call for next week to get in front of them right for the holidays. So we're looking good there. We're also implementing a lot of changes to the RCM process, some of which I touched on with the new charge master for self-pay, but also with the care credit and things of that nature, doing prior authorizations for certain patients, and then also making sure that patients have insurance and we verify the insurance at registration. There was a few gaps there as we were going through our daily operations. And so to close that gap, we're implementing new policies that everyone gets checked for insurance, whether or not they think they have it or not. So that's something we're working on as well. And so Kim kind of already touched on it, but we're trying to look at what it would look like to right size some of the staffing at the clinics, the manor, and kind of where those staffings are coming from. So whether it's internal or if it's a agency that we're getting people from. I did a preliminary review of the manor and found that essentially 37.6% of the workers make up 51% of the total expense for salaries. And so we're very over indexed on the salary side, not necessarily the personnel side, but it'll allow us to re-examine that, find new ways to approach the staffing at least at the manor, and make it better for everybody, honestly. So this is a lot of the outsourced staffing, so to speak. So we're looking at that very closely. And then of course, we're looking at pay bands right now. There's some things with respect to pay. People have been here for 10 years, didn't get a raise. We looked at that very closely. We plan on rolling out in January of 26. Rebecca and I are going to look at that and see kind of where we can make some movements and true up some payment for people. But all in all, yes, it was a rough month, but we did make $310K from operations. So it does feel good to end on a positive note. If you have any questions, I'm happy to answer.
You can say excellent.
Thank you.
When you say it was a rough month, it's to no fault of our own. It's just was a slow month, basically.
That's right.
Yeah.
It wasn't slow doing the work, but it was slow doing with the patients' visits. So.
That's right. Yes, sir.
One of the things going through the department's reports, I noticed there was no income from the manor. had the expenses listed in the big report, but no expenses per. You guys, I'm not sure you have the big report.
No.
No,
That's all I remember.
so the one thing I will draw your attention to is that there's some reclass stuff going on. And so perhaps the
Page 1 of the big report, nursing home revenues. No, at the number 1, the summary of the department reports.
Isn't this the consolidated?
Yeah,
Yeah, this is consolidated. It's not.
And
then on the-
revenue, ooh, it isn't on there.
Right, and then on the detail,
So I
on a
don't-
big detail for the nursing home.
I don't make these, Sage makes these. So if this is not on there, it hasn't been on there in a very long time.
Well,
Yeah,
the
it has
reason
been.
for it is because that is from a different system.
It's from Point Care.
Care,
And it
yeah,
has to be entered in
right.
to the journal.
That would have been good to know prior to this.
I didn't know, I didn't know you had given these, so, but the nursing home revenue, you remember what it was? It's usually right around,
400
Yeah, that makes
on
sense.
AR.
yeah, it was like 440, or 450,
Yeah,
something like that.
It took a long time for us to figure out all the
Which
different
that will make a
systems too,
difference on
Paul.
your total number, probably, so we'll work on that. Let me tell you about those. Those are still the sheets that are gonna improve because we're not working with those directly with those profit and loss sheets yet
Yeah,
until we have everything clean.
quite honestly, they're worthless, to be honest with you. They're worthless because of everything that happened over the past 18 months plus. And yeah, that's kind of the issue. With respect to the cleanup, and you'll see kind of on the bottom left-hand corner of your sheets there, everything's gonna continue to change as we continue to clean up the way the financial statements are linked. If you change one thing in one period, it's gonna flow through across the periods. So as we continue to do this, if you go back and check, things will be there. Yes.
I think for the public, I think it's a good question to ask. We're another month into Paul being here. Has, based on what was our discussion out of the last meeting, I'm not sure, was it the special meeting or the last meeting we had? Has any of your views changed of what you're asking for related to a audit? Anything different now, 30 days later or a couple weeks later?
Yeah, so to clarify, I've been here 30 days. I feel like when I first talked to the board and when I first spoke at the meetings, I thought I was dealing with maybe some backwards journal entries. And I had the board meeting on my first day here. And so the deeper I dug, the more concerned I became, and which is why I reached out and asked for more assets with respect to TYA, forensic audits, things of that nature. That has not changed. We still need to do a forensic audit. We still need to take a deep dive and look.
And it probably will be further back as well.
Right.
In years.
Yes, yes. So taking a look at the past 18 months first, because we have some regulatory requirements we have to get out there.
Right.
And then past that, we'll look deeper, 24 or 36 months. So it'll be a process, but it's one that needs to happen.
So nothing's changed at this point from what you're,
Okay, sir. To be clear, nothing's changed.
thank you.
So on that note, from the finance committee, we did talk a lot about the 3 different accounting firms that Kathy and Paul are looking at, and they're interviewing the 3. They will bring us 3 bids, hopefully, and give us an analysis and a recommendation on which one they think is best. What they are currently looking at doing is satisfying all of the regulatory requirements in terms of filing the cost report on time and whatever else we need to get us back on track is the primary focus. While they are doing that, they will also be diving into the forensic audit part and the going backwards. Their initial focus will be on getting us current, but they're not going to stop with the
portion, of the forensic audit to move us forward.
That's right.
Yeah, and I think the only other thing is that we have an opening that we had kept open for accounting, and we're probably gonna need to add that person in order to get through all of the mess we have right now. So, I have no doubt Paul will know how to utilize them in the way that we need them to be helping us. And truly, we want to have somebody of enough caliber that they really do understand, so we don't have any more mistakes coming out. So it will likely be somebody remote, because we don't know that we have that breadth of talent in the community.
Any other bombshells, Ted?
Well,
The
follow up on my
The nursing
question.
home made $443,620.
Okay, even on this, page 1, it shows 0 nursing home revenue, so 423,000.
Yeah,
Well, that-
443,000.
Okay, I'm not much for accounting, but that should change your bottom line. You
Yeah,
take the
yeah,
pluses and minuses, I got a
Yeah.
people around here somewhere.
So
well, take
Actually,
mine in the
that's kind of
meantime.
Did you take it?
on a revenue basis maybe, but not really on a cash flow
You got it.
basis, so. That would have been more clear. Yeah, I apologize about that. No one told me it didn't work.
423,000.
443.
440.
I wonder how long that's been happening.
It's actually been on there before, because it was something that Tish put in there on the PPL. I think she had to make a journal entry to do it, but
Oh.
right, yeah.
And that's kind of why I asked for the cash breakdown by, well, by, I don't know what to call it, by acute care, clinic,
Nursing
SNF,
home.
yeah, like
Mhm.
big buckets, not like radiology and
Right.
inpatient, outpatient.
It definitely would show
So,
different on the revenue side for sure. Yeah. But you couldn't have known, I didn't even have that paper, so I didn't know to help him, or I would have helped him. I think that's very small potatoes compared to everything he's gotten done in an amazing amount of time.
I'm not.
Overall,
No,
the
but
finance
good
committee
thing
was
you
very
noticed that.
impressed and excited.
Yeah.
So,
Any other questions? Okay, we'll move on to the CEO report. Kathy?
Well, I'm gonna go over some pretty fast, because with all these little reports out there, they're doing most of my work lately. So, lab equipment, we are looking at some pricing on some lab equipment. We still have that rural health transformation project that's out there. We don't know if it's gonna help us like we want it to, but we are gonna put some thoughts together, so that when they do send out the information about that money, whether or not we can get some things that we would like. There's actually some relatively low cost outlay, like around $22,000, for us to do some microbiology in-house. If we did the microbiology in-house, we wouldn't be sending it to Monument and then on to Mayo and having that uptick of a price on it, and then we have to put a price above it. So what it will do is twofold: lower our costs and lower the patient's costs as a result of that. So that's the goal that we would have with some of the lab equipment pieces. We're trying to get to have a little bit more robust lab, and Aaron's on board with that, so we're working through that. And as we will have the Vapotherm, we will just pay for it here soon, to help us keep our patients. You guys heard about the survey. I thought 3 people on 1 poor resident was a lot, but the residents handled it pretty well, because they had 3 around them a lot of the time. The departments that we're focusing on right now for problematic things, we call it problem focused areas, is dietary and the manor. The dietary has been that way for a while, so we're coming up with some different strategies. We have looked at a bid or 2 relative to what would it look like if we outsourced? The biggest problem is getting the leadership that we need in the department to keep the other staff. I think that one of the strategies that we want to come back with is that we can actually move their wages up some to entice them to stay better and not be in so much competition like Taco John and all of those places, and have a better rate for people that are in the department so that they stay in it, because we've had people leave for 50 cents, $1 more or something, because we're not paying them as much as they could make someplace else. The only reason we're trying to do that is to also stabilize that staff and not have a re-recruitment. As far as what we're going to do for management and leadership, we're still talking over that. We spent 2 hours on it today. And one of the things that we're looking to do is go ahead and advertise. We feel like we've done a whole pro forma on it, which we can talk about. But basically, to bring somebody in from the outside would cost us $575,000 more than we already pay in a cost center. So that would be over $1 million. And yeah, and yes, there's the finance guy. And so we really don't find that feasible for us, and the contract was a nightmare to look at, to be honest. So we're looking at maybe trying to entice somebody with a good salary to be the lead, that's maybe got more of an executive chef type of thing, so that we can attract somebody with a lot more knowledge and education to run that department in the way that it needs to be ran. And through some of the survey work, or some of the people that we've been looking at for potentially helping us, our kitchen's not really in compliance. It's nice that didn't get really caught too much in the survey, but there is compliance issues there. So we need to move on that. And so if you look at dollars over this piece, what we're really looking for is the support to be able to increase wages, to try to keep stabilization there, and then to hire somebody that's at a higher level of management capability, because we just don't have it right now. So, and that's going to cost us probably $70,000 to $75,000, which is still cheaper than going into almost $600,000 in differences of the cost for trying to get that department stabilized. So we are very concerned about it, and we haven't found a solution for a year. So we just have to bite some other bullet and see if it'll work. So on the manor side, our goal is to also look at what we can do to incentivize the pay from where we are at right now, which is 1936 or 25. We probably have a difference in opinion on the cents, but we're looking at whether we can do some changing of those wages as well, so that we can have people that actually, we have some of the travelers that would stop working for the travel agencies and work for us if we could bump up our salaries that we like, not the travelers we don't care for. So part of that is twofold. It's giving people a more livable wage index, and then also lowering our overall exposure from the cost of travelers, because the travelers are costing us, I don't have that in front of me,
51% of the total value.
Yeah, 51% of the total value of our wages that we're paying out. So that seems like there's a lot of room to make some differences for the employees, and then try to bring in other people, as well as in the hybrid programs and stuff that we work on with CNA. So those are two adjustments we believe will make a big difference, and that is more affordable than the current way we are going, which is not affordable. So we have the 3 audit firms that we'll be getting back to you guys by next meeting. We have a focus right now with the senior leadership team, which is the director level, of really trying to drive some changes relative to email etiquette. Believe it or not, we need to have some email etiquette pieces done. And we're working real hard to focus on what does respect look like in the workplace, and how do we show respect to each other, and as well as the chain of command, because we have some problems, I will say, with either hurt feelings or things that go on where just go to your next chain of command. So along with that, the director level are going to be taking on, and are starting to take on, more responsibilities as at a director level. We did have I have a preliminary rollout that I want to roll out in January. I hope maybe I'm going to see, there's a few things I want to get in place, but what we would roll out is the delineation of directors having more direct reports from a manager standpoint. They'd have a manager underneath them so that we have a little bit more room for people to go to people, and we have directors really actually being able to maximize the work that they're doing so that they can, that's part of succession planning. That's part of making sure that we look at operationally the differences in salaries and making sure that the salaries make sense to the scope of work that they're doing. So that is one thing we are working on. We have some letters for admissions of residents now that we've worked on, as well as the letter that says that we need to secure your pension at minus $50 if you're pending Medicaid or you don't have a pay source. Those things were not in place before. So the letters of admission, we're going to have to educate everybody on, because it will start probably even on the hospital side, where they get a letter that defines that they have 5 working days to be able to get their Medicaid, the information for Medicaid pendings in. If they don't get it done in that time frame, then they either get to go, they won't be able to go to get admitted into the nursing home, because we have to have that start point. And we have had some families that literally don't bring it in, and they've been probably, I don't know what they've been doing with the money of their parents' pensions or Social Security, but we're not seeing it. So both of those things need to be corrected. Okay. Yeah.
That's the cost for fusion.
Oh yeah. Cost for fusion is $248,905
That's a month.
a month.
Cost for fusion.
Fusion is the travelers on the manor. So you take that 420, that cuts a lot of our money out on the manor side.
Average CNA makes $19.92. We can pay our people here in Weston County a livable wage. We can train them. We can have, I use the baseball analogy of having a farm team. We can pull from the farm team as necessary. So that's kind of the
That was a month.
$248,905 a month. That's right.
It's terrible.
There's a lot of meat between what we're paying and what they're getting.
So one interesting thing that came out, and correct me if I got the facts wrong, in finance committee, Paul had run a model that while it seems insurmountable to get rid of all the travelers and reduce that expense, he had run a model that showed we're only talking about 11 people. Like if we could recruit 11 people, we could take care of that whole problem.
Recruit and retain.
Recruit and retain.
Right.
Yes.
That to me is the challenge.
And that, I mean, that doesn't sound
No,
so bad.
insurmountable, no.
Yeah.
The retain part, I think, is a challenge, but I also think if we get really competitive, because that's what the rural markets are having to do, we're almost a frontier. And if we do that, we can probably draw people in because they can afford to live here better. So that's the theory. And it never hurts people's feelings if you give them more incentive to work. So I did want to highlight that the clinic has gotten to a greater than 90% collection rate, which is awesome. Their seasonal themes make a lot of difference for patients and the environment that they have over there. And the community outreach, I think, is just going to exponentially make a big difference. So I wanted to say thank you very much to you and your team. You've done a great job. And it really is the strength of leadership that has made a huge difference there, because the staff because they are willing to follow her because she's such a good leader. So thank you very much for your work on that. Ice storm that we had caused lots of stormy weather around here because it was hard to keep up with the ice removal. So one of the challenges that I don't have a fix for is our parking lot at the clinic. It is terrible grade anyway. But we're trying to work out between the teams what times are the right times to ice. I've lived in Kansas with ice storms, like serious ice storms, and it's really hard. It is really hard to keep those clear when a true ice storm is going on. But we've got to work together to try to see if we can do that and not run out of ice melt. So that's the piece. The mill levy was held from us, so we did not get the mill levy this month. I have talked to Allison, and I'm sure she'll update us later, but I'm not blaming the state. It's because they got a letter from, I'm not blaming the commissioners because they got a letter from the state, but I do not believe that they have the statute, that they have any ownership of that mill levy piece from a state standpoint. So we're going to try to get an answer to that through the Attorney General's office. I will tell you that 704,000 is less now, whatever he told you earlier. My only concern is that might be held. My hope is that we're going to try to get what it is audit by December 31st done, so that then our money will stop being held and we'll start to receive that money back by the end of December. I don't know if we can pull it off, but we're going to try to do that. So what that means for us is that I don't think we can get a clean audit. The interesting part is that I have notes that show that we can have longer time for that. But the truth is if we clean that up and go forward with the knowledge from the attorney generals and everybody that we are trying to be transparent, we have a second opportunity to update the cost report and give them a true shored up audit. I said cost report, audit. We have the way to shore that up down the road. You have to do it by June. And so what I'm thinking we will do, and Paul can chime in when he wants to, is we basically try to get the audit taken care of so that we don't have our money held up, and we deal with the hit on it because we've already let everybody know we've had a hit with irregularities. Then we move forward clean from there once we get all of our auditing done and completed.
Please remind me, because I can't remember. So the state told the county commissioners not to give the money. Is that how that went?
Yeah.
Correct.
Okay.
Yeah. I don't know, Allison, if you have anything to say on that right now.
Only that I've reached out to the AG's office again to follow up on my request to them for clarification.
Okay. And you haven't heard from Stolken, have you? Or
no, I've copied him on my communications.
Okay.
And I don't know, Kathy, if this is a good point to chime in on the public media that I saw today.
Yes, it is.
Just for the board's sake, there was an article on Paul's findings and the request for the audit that was in the newspaper recently and on Facebook. And there were some public comments saying that all of us should be removed, including the attorney, and sort of pointing fingers at me and us for that, which, as I'm sure you all realize, I don't have anything to do with the hospital's financials. Additionally, it said that I was terminated from representing the school district in Weston County. That is not true. The law firm of Love Now Law continues to represent the school district. I had asked one of my colleagues to handle that matter because I was too busy handling your matters and other clients. So just wanted to clear that up. And, I know there are people who are cheerleaders and those that aren't, but it's problematic when there's misinformation being spread about me. In this facility online. So just wanted to clear that up. Thank you.
Listen, I just had a question. So I'm sorry. Where was this article at?
It was comments made from the newsletter journal. Yeah.
On Facebook.
On Facebook.
Oh, it's on Facebook. Okay.
Allison, has Mike Stolken been helpful in trying to get some clarity to the withholding of funds by the county issue?
He has been cooperative, and I have copied him on my communications with the AG's office. The AG received my email, acknowledged it, and said he would get back to me a week and a half or 2 weeks ago, and I hadn't heard, so I emailed him again. I think it was today. It's all running together. And sent a copy to Paul and Kathy so that they could see a copy of what I had sent. William, the issue is there is a statute, and I think I shared this with the board,
that specifically addresses the audit requirements for Wyoming's special hospital district, which is different than the statute that allows the county commissioners to withhold funds. So it may not be much solace to you, but those funds will be there for you once we're able to either get the clarification from the AG that's required or meet the requirements for the State Department of Audit to release the funds.
But the reason I asked was different. The reason I asked was because the county attorney's authorized to issue an opinion which is binding in the county unless the AG says otherwise. So I would wish Mike was forthcoming and being helpful because he could help with his own opinion. That's why I was asking.
Yeah,
Well,
thank you for that question, and I'm happy to follow up with Mr. Stolken and see if he's willing to help take a little further steps on that.
And
Thank
just so we clarify, like, we're a special hospital district. We actually have schools that are set aside different from public utilities and things. And I think that they're getting combined together and they're not supposed to be. That's what I think. So, safety, I was just going to mention it, our safety work we're doing right now. We have lots of discussions about safety. We have lots of ways to spend money we don't have at the moment, but we're trying to work on. But what we are going to do is work on some public education and some pieces where we feel this would improve our safety given what we've been through with that safety issue last month. And so we're going to ask visitors to sign in when they come in to the building and vendors as well, so that we start having that ability to know who's in the building and what's going on. That is not unusual at all. It will be unusual for Weston County, but I think the biggest reason for us is that we found that we let people through that we were trying not to let through, and it's one way that the staff feel like we can kind of control traffic a little bit. It's including the manor that we would do that. I think it makes okay sense with the manor too, because the manor has had a couple of times where somebody took somebody out and we didn't know they took them out, and then we had to chase down the person that they were taking them out. So it's a what I call a fast cycle of change to see if it makes any difference. We'll educate the public and see what it does. But the other piece that we're going to do with that is, like in the ER where we have traumas and stuff, let's limit to one person that can be in at a time in the ER so that they're not disrupting the patient care that needs to go on. So those are, I got that about right? Safety people. Okay. So those are some steps that we can take to try to enhance our safety and enhance this flow of traffic, because sometimes it can be out of control, and have that work. We've had very irritable family members in the ER and stuff, and then they get in a whole bunch of them in there, and it's just not good. So
I'm sorry, I kind of am sidetracked here, and I just feel like, from a public standpoint, I want to go back and we need to talk more and address this issue of somebody. I just want to make sure everybody understands what we're talking about here. So somebody has gone on Facebook, anonymously chosen to attack the board, and is that what we're saying?
No.
Oh, that was the previous one. That was our previous conversation. We had
Yes.
people that went on Facebook who did attack board members. They attacked
Leadership.
Well, I don't know if they attacked leadership. I can't remember, but I'm so used to that. I don't even look at it hardly. And then if I know somebody and I know who they are, if I can figure out who they are, I might try and call them, because I did that with the levy. But we do have people that are inappropriately, and sometimes the same people, writing false
And these are
narratives.
anonymous.
No,
They're not.
they're not
The one
anonymous.
that they said talked about Allison, that person is not anonymous. No.
Okay, that's my question. All right.
Yeah, that's that piece. And the other piece is really not anything that's any different in any other hospital or manner. It's very normal to ask for it. We're not going to police them like super hard, but we're just trying to get a sense of traffic and look at that, whether we have any other issues we need to look at. Because we've even heard that people are coming through doors they're not supposed to come through, patients, families and stuff. So it's kind of trying to look at that whole piece and secure.
But I don't think that's not uncommon. I mean, I know when I worked for the school district at the high school, you have to sign in and say who you are, what company you're representing, who you're going to see. Plus they get a visitor's pass, and
Yeah,
have
that's
their
what we're gonna
name and
do
stuff.
too.
And so, I just think that's good protocol.
Yeah, so just wanted to make you aware of it. It will be different for this community, so some people will not like it. But it's just a safety feature.
I will say that the post that I saw about Allison specifically was the same person that posted stuff when we were having trouble before.
Right.
And she was real vocal then too. And it was the same person.
And this is the same person who's calling for everybody to be fired and step down.
I did not see that post. I saw the post from her about Allison being fired from the school district.
And other people, jumped on too. And so here's the balancing act that I have. It's like, I can talk to you if you're willing to talk to me about something. Some things, when it's your opinion like that, where do I go? I'm not sure where I go. And so for me, it's like, where do I want to pull my attention? And I really want to pull my attention on what we're doing that's good and how we are really working to be transparent, how we are working on the audits, how we are working on improvement in quality of care. Those are the things that we draw on. I don't know what to think about people that repeatedly don't let something go, because I think that there's a certain portion of that could get them in trouble if somebody chose to do that.
Well, and I think it's important that as a board, we're calling out this backseat quarterback, easy to make comments when this group has worked so hard to get to the point where they're at. And is, from my viewpoint personally, a false attack for unknown reasons that this board can't just ignore in this small community and say, that to the public who might be listening here, that this is absolutely a lie and not the truth. And I think that's absolutely critical that we get that out there and say such things, not just ignore it, not just walk away. That's my opinion. But,
Well, and
that's fine. Yeah.
And that was part of the thing about the communication protocol is, I agree with you. I don't, anyway.
Honestly, I felt badly for Allison because Allison's done nothing but good work for this board. In my opinion,
Mine too.
Her input and her work for this board is invaluable, and I'm grateful for her. And as far as me as a board member, the community is going to have a chance in a few short months to tell me if I did a good job or not. And
right.
if you'd like to run in my place.
And it's just too easy to get on social media. I mean, somebody's welcome to come to our meetings and have these discussions. It's just too easy to get on faceless social media and make comments that are absolutely unjustified. So
I think we live in a democracy. People have a right to their opinions and to publicize them. So giving it all this attention, I take a different view than Ben, is a waste of a lot of time. For a lot of the public had the intelligence to know everything we've said here, to know about these people that harp and complain without factual foundation. And actually, I've learned quite a few people in Weston County are aware that it's unfair to pick on an attorney who has to keep one's mouth shut, has confidentiality issues, and cannot respond, thankfully, will not respond like another crazy citizen. So I started on Facebook. I just leave it on Facebook and leave it up to our citizens to exercise judgment.
Well, normally I would agree, but those have been very damaging to this hospital in the past. That's my point.
Well, there was one thing that in particular that bothered me, which was bringing up Piper, because Piper left with an agreement. We had an agreement between us and she left. And I don't know why that's still boiling, because it's over. It's past. She's moved on. We've moved on. So I would say that part. And, even if you don't like the outcome. I get it, but we all move forward. So.
Actually, not all of us. Some people refuse to move forward.
Right. The only other thing I thought I would mention is the charge master. We are going to get that out into our and uploaded into our system so that we have updated pricing. I would anticipate from what they told me, it would take 2 weeks. So minimum of, well, they told me 2 weeks, so I'm going to let them help me that and be truthful. And so Epic said 2 weeks. And so if that happens, then we should be in January, we should finally have the charge master uploaded. That's the charge master. An updated one. So lots of kudos for Paul because he's pushed a lot of things forward too. So he's done a great job.
Now, what is charge master? What does that entail?
It's literally all of the coding pieces and the charges that we charge for every single thing that we either do a procedure for, have somebody seen for. It's related to diagnoses. It's related to wound care. It's a fee schedule. Yeah. So that's the
very complicated.
I think if I remember right, there's something like 4,000 charges on it.
Yeah.
So, yeah.
Well, we had talked quite a bit in finance committee too about making a simplified public charge master. So like if you say, I need a chest x-ray, how much is it going to cost? Making something simple so that we would be able to answer that question. Because right now there's like 46 codes for a chest x-ray, and you as a public person, if you want to go on our charge master and find out how much you would pay, it's very, very difficult.
Gotcha.
So we talked a lot about making a very simplified fee schedule that we would be able to answer those questions much quicker.
Yeah, because even when you comply with price transparency, it's still really complicated for people. Yeah. So, yeah. And that's my report.
My only comment is you were talking about looking at upping the pay for CNAs, and I do see that you have a CNA training class coming up in January. It'd be nice if
It's the EWC's CNA class.
right. But I'm just saying.
Don wants to know about that too. Yeah,
if you
we can grab up some people, I think I think that would be very good. Yes.
So the plan with that is one of our nurses on the manor is actually going to teach through the EWC, and then they will do clinical at the manor, and then we will, same thing as when we do our classes, we will hire those people.
Can I ask a question? Would you, if girls like wanted to from the high school, would you accept them?
Yep, that's part of our farm idea.
Okay.
Yeah.
We did that in Upton several years ago. We had a lady from Sundance come over and teach, and then I took them to Sundance for clinicals.
Yeah, and then the other ones we would is if a teacher has a summer off and they want to be able to work some hours, especially with us looking at a different salary range, I think that might be more attractive. Then maybe we can have people that can help some of our staff take time off and give the advantage to the community of having another opportunity for income.
I cover these things extensively, so I know exactly what's going on. And we write these stories and tell people exactly what's going on. And then you go back on Facebook now and you see people that are like, oh my God, what are they doing? What are they doing with this money? We raise this money for this, or they're spending it on that. Like, and I just want to encourage people to go and ask the people that can tell you.
Yeah.
Like,
or read the paper.
Or read the newspaper, because you can go to our website with a subscription and search Newcastle City Council, and every City of Newcastle story will pop up for you.
Or legal notice.
Or legal notice. There's lots of ways to find that information, and I just find it so silly because you watch these people ask these questions on Facebook to people that really have no clue what's going on, and then you get this thread of 400 different comments contradict each other and include half truths and whole lies and assumptions
If you're a teacher and you pay your student loans off, I'm pretty sure it's hard.
Mm-hmm.
Oh, sorry. Anybody else have any questions?
Ted has a
I got a question.
Go ahead, Ted.
I applaud Allison for looking into this withholding of funds, because I think there's a lane there that could be followed. But just for clarification, the letter came through the Weston County Commissioners, but it is to the treasurer to withhold these funds. It's not to the commissioners withhold the funds, it's the treasurer to withhold the funds. And they're quoting state laws, and until the commissioner's duty would be, if, as I understand it, that they would have to dissolve the district if some of these requirements are not met. Now, I don't have a law degree, but I applaud Allison to looking into this and trying to rectify and clarify.
See, and I'm not even sure, I'm just making a comment. I'm not even sure that they could dissolve it, because I think that there's a challenge there as well, because we have a board and people voted for that board. And so therefore the board is in charge of the decisions relative to that.
And I agree, it's the state telling the commissioners what to do. Because
right, I know, yeah.
The state commissioners don't get to write laws, state writes laws.
No, but it's sure made news lately,
Yeah.
so.
Madam Chair, can I ask Ted a question?
Yes.
Ted, I can't recall this ever happening before in past years. They've gone so far as sending a letter saying withhold funds. Do you remember if it's ever been
I
done
think you have a
before?
different county attorney reacting to what the state has told him to do. To write, we read that letter. I don't know where that. The letter was presented to the commissioners. So whether Michael, county attorney, had copied it or had wrote it himself, I have no idea where that, but.
And it just further hurts the community and the hospital, because those funds are needed or we wouldn't have asked for them.
But at the same time, he is following what the state is telling him.
Oh, I know.
Shall happen.
I know. I just think
So I'm not trying to.
Curious.
I don't remember. I've seen districts out of compliance.
Me
but not
too,
getting that
but
far.
not going as far as sending a letter saying we're gonna withhold your funds. I feel like that's a new thing, but I might be wrong.
But this letter comes from the state.
I know, yeah.
That's just pointing out the
I've never had that privilege before either.
Yeah.
So.
All right, just curious.
Any other questions, discussion? All right, Dottie, Foundation Committee Report and the Communication Framework.
Yeah, we didn't have a meeting this month.
Okay.
We're going to meet in January as far as the Foundation Committee. Communication Framework, this is just some brainstorming, I guess. I wanted you guys to run it by you and maybe get some input. This pretty much stemmed from Jen Womack. I don't know if you guys know her, but she is going to be on our foundation committee. But she's really a communication guru, as far as I think she's done a lot of leadership work in the community and getting the word out. And so she just approached me and she said, please, and I'm saying this, that don't think we're insinuating people aren't doing their job as far as communication. We just feel like maybe 10 heads are better than one when it comes to that. And these are just some suggestions or ideas. And so with saying that, some of the things that she suggested is establish a standing press and response framework, which I guess my thought here is, I know the press releases and stuff that you've put out. My suggestion and what I would like to see is, I know the newsletter, it's made it sound like this is coming from the newsletter, when I would like to see either on the website or on Facebook having it come from the hospital or the
Yeah,
health
and we wrote,
services.
oh, maybe they did that so they didn't charge us for it. They might have done that because I haven't seen the paper yet for that part, but, and then, we sent the same news release out to the Gazette. And
I saw that.
And the Gazette, had a big article on everybody that's in trouble, so to speak. And so I don't disagree with that. I mean, actually, I don't remember now if I had Charlotte put that out on social media, I might not have. So you've got a good point there.
Yeah, and I've just noticed, and this is my personal perception, is it seems like the manor, whoever's doing that, they do a really good job as far as
that's Charlotte. She loves
media. I mean, I love seeing stuff about the manor and things that are going on. I just think there's times where maybe with the hospital end of it, we could do more of that as far as highlighting. Because to me, it seems like when it's coming from Facebook and it's coming from the newspaper, you guys are the ones that are doing all the work on that. So let's toot our own horn and give ourselves a little bit of that credit, which I agree with you. I think the newspapers is a good avenue too, but if we could just do it on our end as well. And the same thing as far as leadership changes, service updates. If it's coming from us, I think that kind of dispels some of the rumors, maybe. So that's that part of it. And then launch an ongoing People of the Hospital story effort. And basically what that is, and I don't know if you watch Facebook, but like the school does employee spotlight.
Yeah.
And I just think if we did that, at the hospital end where we highlighted some of the people and the things that we do, because, like Jen wrote here, it says, a steady cadence of short human-centered stories, nurses, providers, technicians, and support staff reminds the public that the hospital is staffed by skilled, caring neighbors. These stories quietly rebalance perception over time.
Well, I just think that there's more we can do because we certainly have had some stories in the social media as well, but I think that we could continue to work on refining that. We do try to we don't announce every new employee in social media. I mean, I don't know, we could look at that. Some employees won't let you take their picture, but we could look at trying to do that as well. And I do agree that we have a lot harder time with your staff letting us do filming over there. And so we're going to have to convince them that that's how they sell their work that they do. Okay. You heard it. She said they'll do it.
There you go.
Okay.
Awesome.
Okay.
And then number 3 is that move from online confrontation to direct conversation. And basically you mentioned that as far as, and you guys can just take or leave these suggestions, but what Jen is saying here is, if you know the person, instead of trying to argue with them on Facebook, maybe contact that person and just say, hey, I just want you to know that this is the way it is, or something, I mean, basically like with Paul too, I think it was the same person that was posting the other negative thing with him when you did the press release. They said, well, I wonder where this $115,000 is coming from, and is it more taxpayer money or something? And I just want to say, hey, you do realize that he is just replacing a position. This isn't a new position.
Yeah, I mean, we can try to do that. I always get comments about people's salaries because they don't understand what competitive salaries are about to get the talent that you need. And it's industry standard. It's actually, we actually are sometimes on the low end of that standard. So I think that's right. I have called people I've known. I do not, and I ask my staff not to. We're not really supposed to react to any of the negativity. No. So we don't do that. If they're on our page, we get to delete or hide stuff that they say that's negative. If it's on the newsletter journal,
right,
we don't get to do that. And to be honest with you, I think I think that there's a part of me that, sorry, Dan, just 1 second. I think there's a part of me that says pretty soon, maybe the community will recognize that the same people are making comments without having knowledge of what's really going on still, maybe. So they're just still stuck on the same before record or something. So
I was just kind of going to chime in with that. And the trouble is I have not read this Facebook post, so I don't pay enough attention to it apparently. Here a while back, I don't remember who exactly, somebody was fussing about something on Facebook, and I honestly just went and talked to them, and I have not heard any more fussing from that person. But again, it was somebody I knew. And so I think that we as a board, I think that's exactly what we should do. I like that line, move from online confrontation to direct conversation. That's a wonderful line. We as a board, if we know these people, and after I get off this meeting, I'm gonna go get on my kids' Facebook and figure stuff out. But I mean, if we know them, we should just take the initiative and go talk to them. Is my opinion. Anyway, but I'm appreciating what you have to say, Dottie. It's sounding good. And Paul, I didn't jump in and chime in the middle of everything, but I really appreciate your report, and I thank you for doing the work you're doing. So.
And I did write in my writing on the bottom, I don't know if you know this, but like, if you don't want negative comments or don't want comments, when you do press releases on Facebook, you can control whether they can comment or not.
Yeah, I didn't even think about that, but that might be a good idea rather than having to go in and take it down.
Because you're just reporting news. You don't have to have feedback, but just know that, I mean, that's what the school district does. Is I know a lot of their things, they don't allow comments because you're just trying to inform the public of what's going on.
Yeah, and the good news is there are people that get on there and defend too. They defend pieces. But yeah, I think that's a good point, and it's probably depends on what we're posting, because if we post stuff about the manor, we don't get negativity on the manor.
No.
So
no, it's all positive. Yeah. And then the next one is engage the community, where conversation already happens. And it was ironic that the senior center thing came out right after I got this, because that's exactly what I'm talking about. Is I think that has such a positive impact on our community, and I'm grateful that we're working towards that. And, wherever the public meets, whether it's a senior center or I don't know if they have their chamber coffees anymore, but anything like that, where we have the opportunity to do that. And so, anyway.
We hosted it one time. We didn't have many people here, but it might change over time too.
I've got a concern regarding liability of board members. I like what you're saying. Unbridled, I talk to everybody about anything having to do with what I've learned while being on the board, and where I think I've learned about where the hospital district wants to go and so on. But I have liability protection if I'm acting within the confines of the limits of my role as a board member. So where's that limit? Maybe that's a question you could put to council. How free are we as individual board members to take it on themselves to say, I'm reaching out to you because, and try to have a conversation. Are you?
I'll let Allison chime in, but I think in general it's that they have to speak for themselves and not for the board as a collective, correct?
Yeah, you do not have authority to speak on behalf of the board, but part of being a public board member is that you are available to the public to listen and have dialogue with them. So, you know, do you have potential for some liability? I mean, possibly. You are covered under the officers and directors insurance and state statute as long as you're acting in the scope of your duties. Is talking to the public a part of that duty? I would argue that it probably is in most cases. If you are saying, well, this is how the board will do it, or I'm saying this on behalf of the board, you don't have that authority, so that might be problematic. And then you have civil issues that always exist, right? Like employment law issues, which you don't have the right to speak on behalf of. Health information that's protected, that's not in the scope of your duty to talk about. I mean, you get into other areas of law, but speaking to the public as an individual board member, I think is a natural part of your role.
You could preface every sentence with, in my opinion.
Yeah.
Well, actually, I hear it stronger than that. You better preface it. Which I guess part of why I brought the issue up, to me, it makes reaching out and talking to the public a bit clumsy. Because you can't say, well, you have a member of the public that's interested in issue A, and you, the board member, thinks board of trustees is making progress in that. The new CFO has got some good ideas that will help address it. But you can't say the board is doing it or will do it.
Well, you could say the board has been talking about that, or this was a discussion at the last board meeting, or.
Yeah, so in other words, we'll direct all unsatisfied members of the public direct to the chairperson.
Yes.
Oh, and you can direct people to me
Who can
too.
speak for the board?
I don't speak for the board, but I can speak to the problem. But if somebody, I mean, there's some things, if they're personally attacking people, I'm going to tell them that I can't abide by that stuff. And so there's no conversation to have, because I'm not going to drag somebody down. That's not part of an executive's role.
No.
Or anybody's, as far as I'm concerned.
But to Dottie's point and Ann's on the online confrontation, people say a lot of hateful things on Facebook that if you go and talk to them to their face, they won't say the same thing. So
well, especially when
I
they're saying
personally
lies.
just ignore Facebook.
Well, there's some straight out things that are lies that have been said.
We're not talking about things that can be subjective. I look at this one way, you look at another. We're talking about telling an outright lie about somebody.
Agreed.
That is, I mean, absolutely should be called out and
face to face.
And that's
not online.
And I would hope that individual would want to come in here and have a seat and then have that conversation, but they're not brave enough to do that. So then I'm not talking about you think that this should be done this way and the board's not doing it. We're talking about wanting to destroy people personally, and that is just not right.
No.
So
Anyway, just some food for thought. You can read through the rest of this, but I just wanted to remind you too that Sagebrush Market does do the tent trifolds and advertising is free. So if anybody has any upcoming events, they do, I think, like I said, they're already working on January. So they're probably at least 2 weeks if you know ahead of time, if you could let them know. And so I just think, like I said, not to insinuate people aren't doing their job. I just feel like if we can all kind of toot the health services horn, better off we are.
Thank you.
Thank you.
Is there anything else? Executive session?
Great.
We'll need a short break.
What
Oh,
about, do we have bylaws
Bylaws.
discussion?
Oh, yeah, sorry, Ann.
Bylaws discussion, Ann.
Well, we got through Article 1 and Article 2 with our ideas and new rewriting, and we're working on 3. Is that right, Mary and William?
Yes. I believe so, yes.
Yeah.
yeah.
And so we'll have an upcoming meeting here, which we don't have the date of. So if you two want to decide a date and let me know, you could. Anyway.
Well, no action's been taken, but the committee is comfortable with coming back to the board with a proposal on Articles 1 and 2 for new language. And we'll try to go through all the bylaws to be able to come back with a proposal on the whole set. But nothing's, the committee itself doesn't make any changes.
Right. Yeah, exactly. Yep.
Madam Chairperson, whichever of you two that is. I did look, and the statute does require 45 days notice of the bylaws before they are finally approved. And so
Okay, that's
just for planning purposes.
okay. That's nice to know. Thank you. Okay. So that's all I have, but I am encouraged, and we are making good progress, and we look forward to the day when we can give them all to you and you guys can start making your changes to what we said.
Anything else?
Mary, I did forget to mention I have a credentialing file.
Okay.
It's for nephrologist, Dr. Eric Sawyers. There's nothing
Okay.
concerning in here, so I'll give it to you.
Okay, thank you. So take a 5-minute break before executive session.
Well, I was trying to think of anything that we even need in executive session, because we haven't finished up the contract work yet. I think everybody here knows anything they need to know relative to any employee issue. I really don't think that we need to go further today. So I really am saying we don't need any. Huh? Do we have one credentialing file? So that's what we have for executive session. Okay. One credentialing file.
How do we have any ideas for action? And this probably should have been talked about in the finance piece, but so do we have any, is the cost report trying to get done first, or the 2024 audit first?
Cost report's done, just needs to be amended.
The cost report's done. It just needs to be amended from what we've seen, but it's all ready to. And actually, they sent us a letter saying that they knew that that and the audit were going to be, that they were going to be looking at revised ones in June. So they know that.
So why are they withholding our money from the county then?
Stoffers and Myers, the auditor.
It's an audit that they want.
It's the 2024 audit that they want done. And it's getting close to being done. No.
Correcting as fast as possible.
Yeah. Yeah. Okay. Well, very good. So basically you're saying the cost report's done.
Corrected.
The cost report is turned in by Tish. So therefore it has, in our opinions, irregularities to it.
Okay.
Find out what the other information.
Yeah. So it's turned in. It's the drag now, as far as trying to get stuff done. So.
But it has to be fixed by June.
Well, that's what Myers and Stauffer said. What the state told us was April 1st. So my guess is that the state has an April 1st deadline and the federal government has a June.
Okay, that makes sense. Okay. Okay, thank you for that. I appreciate it.
Based on what I'm hearing, the motion for executive session can exclude A2.
Yes. I think we should take a break.
Always in favor of breaks, especially with
Yeah.
coffee.
So how about a break for,
Yeah, and then it'll be executive session, so the rest of you guys can have your night. Rebecca, can you take this? I don't know the rate. And we're gonna look to make sure Fusion doesn't have a fee, but this is a we're going to.
thank you.
No problem. I'm very good. How are you? And she didn't know a rate, so.
Wow. $100 an hour.
$62
Not quite that much.
Darn, I was feeling generous.
I know. While we're on the break, did you need to talk to me for a minute?
Better tonight, yes.
Okay.
Not with all that ice cream cones. I would, yeah.
You're not leaving, are you?
Done.
Okay.
Thank you, Tish.
Thank you.
Silly
Ma'am.
question.
She doesn't even listen to me.
Anybody want soup?
I'm going to use the other hand and come back for soup. It smells delicious.
Thank you, Dottie, for your suggestion.
Oh, yeah,
I'll get hold of Jen. I didn't know who printed those.
yeah.
That's very.
Well, and when you do get a hold of her, thank her too, because she's the one that brainstormed all of this and.
Yes, sir.
Okay, we just need to open the doors again.
I heard it. You're right. Oh, I get it. I get it.
Okay, thank you.
I was being slow.
Okay.
Oh, we need to talk about the engagement of accounting professionals.
Should we handle what's motion of
Oh,
accept?
You want to make a motion on credentialing?
Okay, Madam Chair, I make a motion that we approve the credentialing for Dr. Eric Sawyer, MD Nephrology.
I just put you back in. Sorry about that.
What's the first name?
Eric.
I second.
have a motion for credentialing. Any discussion? All in favor of credentialing Dr. Eric Sawyer, say aye.
Aye.
Opposed, same sign. Motion carries.
One more person for the community. That'll be good. One more provider.
This is someone that has represented a willingness to travel to Newcastle.
Yes.
Next, engagement of accounting professionals.
We actually are deferring that to, because we mentioned it in the public meeting, so we're gonna talk about the selection process and the recommendation next month.
Okay.
Unless something happens that we can do it faster. But
Any other business?
I just have a quick question. With the audit, I know you're working with these 3 firms. Is that gonna be something we have to wait then to the next meeting? Or do you
we
think
could,
we're
if,
going to have a special meeting?
I think there's a possibility, if you guys have the time, we could have a special meeting just to get the contract taken care of. But I don't know exactly how fast we'll get the full picture. What are you thinking?
Pretty quick.
Yeah, maybe pretty quick, maybe within a couple weeks. It's just, maybe we'll try to see if we can meet a little bit after the holidays to get that going. So that, because I'm guessing they won't get started on anything before then.
It's high volume, low depth, right? So it's easy stuff. It's just a lot of volume to get through in one time. And for one person or 2 people to do it, it's near impossible to do it quickly and not make mistakes.
So hopefully we can get them as soon as you guys figure out which ones we want. We can get them started. So
I want the ones that can get it done on time and
do a good job.
do a great
Be
job.
honest.
And answer the phone.
Right.
Speaking for me, not for the board, I'm fine with, I know you guys are interested in getting it done soon. I think this board, in my opinion, is in full support of going forward with this audit in whatever form you think is best. And so,
okay,
have at it. That's what I say.
That's my individual opinion.
My
Need a
individual
motion for
opinion.
that then, or?
No, because it's not a, well, I don't know.
You
I
can,
shouldn't say
I
no.
don't know. It depends on how you guys want to look at it. If you do a motion, all you would be doing is giving us a motion to go ahead with the one but we don't have a dollar amount or anything yet.
No,
Yeah.
And they
but it
kind
would
of,
give you the freedom to engage them anyway.
Yeah.
I think at the last meeting, we did make a motion for them to explore.
Yes.
Yeah, you did. So,
Yeah, we did.
okay.
So I can either do that or.
do,
How quickly does this need to be signed?
Uh,
Credentialing.
Well, the docs aren't meeting till January, but why are you wanting to?
Well, we have a chairman here to sign it, or do we wait for Ann to come and sign it?
Oh, you can have the person that's in her chair do it. Yes. She's this acting chairman. She can put
I felt that way too, but I
Yeah.
didn't want
power, man.
Yeah,
Yeah, feel the power.
acting chairman.
Do you need a what is that, a Del tip?
No.
Oh,
With a feather on the end.
We better get on with this.
Yeah, we better.
So is there any other business?
Madam Chair, when's our next meeting?
Our next meeting is scheduled for January 15th, 2026 at 5:30 PM. We're in the boardroom,
15th of January.
15th of January.
Well, Merry Christmas to all of you.
Merry Christmas.
Merry and
Christmas.
Happy New Year. Thank you for your support.
Thank you for being you.
I move we
Okay, well,
terminate this session.
Okay.
I
Is there a-
second.
All in favor, say aye.
Aye.
Same sign, or nay, same sign. Okay, meeting's adjourned.
Very well chaired, thank you.
Thank you guys.
Thank you, Miss
You did a
Mary.
wonderful
Nice
job.
Thank
Did a
you.
great job, Mary.
Thanks.